Hello, I'm Dr. Stan Miller, and I'm pleased to be able to talk to you today about the certification of added qualification in occupational medicine that is offered through the American Osteopathic Board of Preventive Medicine. And I am the chair of the AOA's American Osteopathic Board of Preventive Medicine. And I have been a member of the college, the American Osteopathic College of Occupational and Preventive Medicine, for many decades now. And so I know much of the history about the formation of this CAQ. And I want to encourage you to look at this CAQ and see if it might help you in your medical practice and help you do a better job for your patient care. And so that's what I'm hoping to accomplish today. One of the things I'll encourage and I'll re-encourage is that you please go to the website. If you Google AOBPM, American Osteopathic Board of Preventive Medicine, which again is part of the American Osteopathic Association, then you will have information and details provided there. And there's also contact information for myself as the chair of the AOBPM, as well as our certification manager with the AOA. And those questions we definitely want to be able to answer for you and help provide information so you can learn. What I'll start talking about is that certification or credentialing can take many forms. We, as physicians, are licensed to practice medicine. That is one credential, medical licensure. Those are done at a state basis, and so that is a form of credentials. Hospital privileges are another form of credentials. Full board certification certainly is a form of credentials, and that requires multiple steps, including doing a formal residency to become board eligible in a medical specialty that the AOA provides board certification opportunities in. And so those have all been ways of getting credentials and making yourself better and making yourself better able to take care of your patient's needs. What we found out many years ago is that in occupational and environmental medicine, that there were not enough residencies to meet the need. And so many communities had family physicians, family practice physicians, internal medicine physicians, other primary care physicians that were performing occupational medicine services to their communities. And they had had no formal training. So our college looked at that strategically many decades ago and felt that there was an unmet need and an opportunity for the college to help members of the college and other physicians that had interest in learning. And so they structured what was called a basic course. They created and structured a basic course. And this basic course is designed to help a primary care physician be able to understand specifics that are found in occupational environmental medicine. It is not a full residency. It's not intended to be a full residency, which is multiple years, but through the basic course, a physician can obtain levels of competency greater than they had before. And so there are multiple components to the CAQ and occupational medicine. The AOA was also very supportive through our board, the American Osteopathic Board of Preventive Medicine, that the CAQ would be recognized as a certification of added qualification. It is not a full board certification, just to be clear. And but it does demonstrate that levels of competency have been attained by the individual that has done additional training and was able to successfully pass a certification of added qualification examination. And therefore they are able to represent themselves as having this certification of added qualification issued through the board that I chair, AOBPM, and through the AOA. So some of the eligibility requirements for a CAQ in occupational medicine is that the person has to be a graduate of a COCA accredited College of Osteopathic Medicine. They have to have successfully completed an internship. They have to have successfully completed the American Osteopathic College of Occupational Preventive Medicine's basic course, parts 1, 2, and 3, or they can have 100 hours of AOA approved CME in occupational medicine over the past 5 years, or some equivalents where they've taken formal training in occupational environmental medicine and have developed those additional skills. They also, in order to sit and take an examination for this occupational medicine CAQ, they have to have a primary AOA board certification. So the CAQ is not meant to be a standalone certification. You have to have an AOA board certification, family practice, internal medicine, some other primary board certification. Then once you have that board certification, you are eligible, if you meet these other criteria, to take the occupational medicine CAQ. You also have to have an unrestricted medical license, and you have to adhere to the AOA code of conduct. So, AOA code of ethics. So those are the requirements to be eligible to take this exam and to obtain this certification of added qualification. There are also requirements to maintain that certification ongoing. Those fall very closely in with other requirements as part of the AOA Osteopathic Continuous Certification, OCC. There are 4 parts to AOA OCC, and active license is one of those. Lifelong learning, continuing medical education is part 2 of OCC. 3 is the cognitive assessment, which now is been replaced from after you've taken the high stakes exam, you are then able to maintain that certification of added qualification by participating in annual longitudinal assessment. And the details of all of this, I don't intend to cover everything, but I would really encourage you to please go to the AOBPM website where all this information resides. And also there's contact information should you have additional questions. And so those are the key points I wanted to talk today to you about. I'm very glad that you have interest in this topic. I think there is a need. Occupational environmental medicine is a very important medical specialty for folks like myself that did residency training and got formal board certification. But we know that many others really have a need to have a skill set where they can better support their practice needs and their patients' practice needs. And therefore, I would encourage you to look into the CAQ in occupational medicine. I would also encourage you to obtain more information than what I've been able to introduce you to here in this brief video. But thank you very much for your interest. And I hope to see you at upcoming meetings. And if you have any questions and follow-up, please feel free to contact either myself or the AOBPM certification manager who's listed on the website. Thank you very much.